Hi, can you hear me okay? Hi, so I'm Amy Gleason, and I'm the Chief Operating Officer at CareSync, and I'm going to tell you today how we help make patients more confident. So we believe that there are a lot of barriers to patient engagement. So obviously by the buzzwords here at the conference, you can tell that it is obviously one of the hot topics is creating patient engagement and getting people engaged in their health. But we think there are some significant barriers to really making that happen. So we solve those barriers by doing a few things. So the first thing that's a barrier is access. So patients don't really have access to their information. So the first problem that we solve is by giving them access. So if I go into my CareSync Plus option here on the screen, you see that there's 3 steps to becoming an engaged patient. First, you request records. Next, you add family and caregivers. And next, you manage visits. So if I click on request records, and you see I get Bruce's providers here. So just to back up just a little bit, here I have Bruce in context. This is Bruce's family because we're a family-based system and we really help family members engage around a person's health. So when healthcare moved from the home into providers' offices, then we lost a lot of that family connection and people giving the whole story around a patient. So one family member may know things about a patient that the rest of the people didn't notice or the patient's maybe not even aware of. So I'm here and I see Bruce's providers. So these are loaded from a database of providers so the patient doesn't have to enter in all the information. And I can just click request records and ask how far I'd like to go back in my records request, what type of records I'd like to get, and then I just say next. It brings up a HIPAA authorization form. From here I can electronically sign. I'm not so good at Bruce's signature, but you get the idea. And then I can send this off. So at this point, we've requested the records, and we go off and get those for the patient. So as you can see, here's one that already has some records that have come back, and they have information down to the provider level broken out. So what we do is we actually contact the providers through this records request, and we get the records however we can take them. Sometimes they come on paper, sometimes they come electronically, sometimes they come on a CD. But we take real human beings and we then make that meaningful, which we think that's the second barrier to patient engagement. Even when the patients do have access to the information, it's not very meaningful to them. So we actually make that meaningful. We summarize every visit they have through their whole entire medical history, and we also make all their information current. So we build a health profile. So you can see here, this is a little higher level view of what's going on with the patient. You can see some statistics here, kind of giving them some information as well as what's been last updated most recently. But I can also click on any of these items and I can see the medication list, for example, and we keep that current. So after every visit, we update the medication list for the patient so that they always have that information. So for a patient, especially one that's sick and going through healthcare problems, it's a lot of work to keep all of this information updated on a list and make sure you understand it, and brand names and generic names, and there's a lot of confusing things. So we take that off, that burden away from the patient, and we create that medication list for them. So a recent study showed that 38% of patients, when they give their medications to the doctor or in an ER, they have something missing or an error. So we take all of that away and we give it in a way that's shareable. So that takes me to the next barrier, which is communication. It's very difficult to communicate information in healthcare. I know how many people are tired of filling out clipboards when you go to the visit. So we also make this easy. So I can show you on my here, we actually send over a report the day before every visit, along with what the patient wants to talk about at the visit, so that the provider also has a chance to think about what the patient wants to do. So we've heard from a lot of providers that they also feel that they're put on the spot a little bit at a visit. So the patient's been thinking about a problem, they're aware of all the details, they know what they want to accomplish, but the provider has 10 minutes or 5 minutes or 3 minutes or whatever they get with that patient to not only take all this information in, but also to come up with the greatest plan ever to fix it. So now we give them this information ahead of the visit so they're prepared and they can actually research it or look things up or think about some options. So you can see here in the summary that this is all the relevant information about Bruce. So it has his medications, his conditions, and then this is the really powerful part. So we summarize each visit, like I told you, to make it meaningful. So these are summary, just short little visit summaries with abnormal results that might have happened, with what happened at the visit and the follow-up plan. And we send only what happened since the last time you saw that provider. So if you saw them a year ago, we include summaries for the visits that have happened in the last year. If you saw them a month ago, you only get the summaries of what happened in the last month. So we're giving relevant, short, meaningful information to the provider so they can skim through it. If it's important, they can ask more information, and the patient has the complete file at their fingertips. So they can always pull up the whole lab report and share that with the provider, or they can pull up the CD of the X-ray images or the MRI. So we've made all of this information meaningful and shareable to solve those communication problems. So the next thing, I'm going to log into the iPad so I can show you how we also do collaboration. The next thing that we do is we have visit planning tools. Here it comes. So this is this is running on an iPad mini. It runs on the iPhone or the Android. So now the patient and their family have all of their health information at their fingertips at the point of care whenever they need it. So if there's an emergency, they go to the emergency room, they can share it right from their device, or we can do like I showed you and show it the day ahead of the visit. So from here we have a visit tool. So if I come in, I can see my visit for today. And then we have a whole visit planning section where the whole family can collaborate around the visit. So if it's an adult child of a parent who's aging and they have a visit coming up, they can put notes and questions and comments in for the doctor on the visit plan and the before visit tasks. And then this goes the day before the visit so that the providers can get those questions ahead of time. And then one of our most popular features is we have a voice recording option. So I can touch on the microphone and I can actually record what the provider is telling me at the visit. So this is really great for people who can't come to the visit. So that adult child that's helping care for the aging parent, they can actually hear the provider's words, and the patient maybe later, if they were emotional at the visit or they've shown that 38 or 40% of information is forgotten within 3 days of a visit. So this allows them to actually have the real recording, and they can listen to it as many times as they need to. My daughter actually has a rare disease, and my parents are very interested in her health, as well as my brothers and my husband. And so I never used to let my husband take my daughter to the doctor because I never was quite sure what was going to come back to me. And so this has relieved me of a huge burden, because now he can take her and I can trust that I'm getting all the information, and he just pushes that record button. And not only do I hear it, but all the people that care about her. So it saves hours of phone calls afterwards updating everybody on the visits. So all of this is a great visit tool, and then you can see the request records button. So at the end of this visit, I can just request those records and pull that out and send it so I get the updated information right away. One more thing I just want to show, that same health summary that you saw on the web. So here I have it at my fingertips. I can go to history. So one of the most powerful things that I didn't show on the web is this is our timeline view on the iPad, so the same thing you saw on the web, but we also have a filter. So I can come in and filter out visits just based on certain conditions. So maybe I just want to see these conditions. And then when I apply that, it filters the summary out to just those visits. So now I can see those. So we can filter by date range, by provider, by medications, by health conditions. So you can really go through and find exactly what you would like to see. So this is really amazingly powerful to have that right there when you need it. We also have all the original documents, so I can pull up the original file. So if I wanted to see this visit, I can pull it up and zoom in on it and look at that regular visit. So I have all of this with me at all times, and I have a share button at the top. So if the provider can't take it electronically, I can always just send it straight over by fax. So we all know that the fax machine is America's favorite medical device. There are 1.5 billion faxes still sent in healthcare a year. So we know that everybody can always take it by fax if there's no other way to connect that information. So by giving patients the knowledge, the access, collaboration, meaningful information, and solving communication problems, we've made them a more confident patient, and we've seen great results. One story I'll tell you quickly, and then I'll take any questions you have. My daughter is 15 years old, and I never really thought she would engage that much in her health information. But once the notes started coming in, she started reading them because they were on her iPhone, and all kids are on their iPhone all the time. So she's reading through these visit notes, and she noticed that it sometimes said she was cheerful, and sometimes it didn't. She said, Mom, why do they say I'm cheerful in my note? And I said, well, really, providers are trying to figure out how you're handling this whole chronic illness and how things are going. So now it's made a huge difference with her because she actually takes her phone and puts it down when she's at the doctor and she smiles the entire visit because she wants them to say she's cheerful. But the outcome of that is she's actually had better interactions with her doctors because now she's pleasant, she's smiling, she's engaged, and so they actually ask her more questions and have better care. So it's really created a confident, even in a 15-year-old patient, she's now a confident patient. So I'll stop there and take any questions that you might have.
Hi, I have two questions. One of them is, do you get any pushback from providers' offices or clinics saying, oh, you're not using our form for the authorization for this information? And then my second question is, I see you have a care manager. Does it integrate at all with like interprofessional care plans? Because I think we're really going to do some big stuff in that area.
So the first question about the form, so it is a HIPAA compliant form, so we really haven't had many problems with providers taking it. So that's been a good thing. And for the care plan, so whatever that plan is that's in the documentation, whether that's a school nurse or a physical therapist or a social worker or a nutritionist or the provider, the hospital, whoever, that plan that's in that visit gets summarized by our healthcare representative, and they create tasks. So I can show you that too. We have a task section where we put due dates, and so you actually get reminders of things that are due, and not just you, but your whole family. Oh, it's coming up sideways. It's kind of interesting.
So you can pick up goals, interventions, and all those kinds of things. That's wonderful.
Exactly, and it's even socially enabled. So you can see if I touch on this, there's a comment box just like on a Facebook post or Instagram post that everybody knows how to use. So the family can all rally around them. So whether that's completing a radiation treatment and you're saying, good job, keep going, or whether that's a prescription that needs to be picked up at the pharmacy and some other family member can say, I've got this one. Or if there's a visit coming, they can give them transportation or help them out with that as well.
All right. How are the records when they request the records to be uploaded from the provider? Are you tied in or integrated with different EMRs, or how does the provider upload the records to you?
So we get them in all shapes and sizes. So we've had records as far back as 1979 that we've gotten for people so far. Most providers only keep them for 7 years, but sometimes we get lucky and they have them longer. But those ones from 1979 were handwritten on paragraphs, so we had human beings that read them and typed them in. Then we also can take electronic, like CCD files from different EMR vendors if they can send them that way. Most of them come by fax. So we get providers that fax it over to us, we OCR it and go from there.
They go to you, and then you put it into the system.
Yes, then our healthcare representatives go through and summarize it, update the medications list, all of that stuff.
How does this work, or can this work with the patient engagement requirements for meaningful use stage 2?
So that's something we've been looking into. We haven't really done much with that, but it should meet all the requirements. We just need to get certified as a solution.
How long does it take for this to be up to date? So if you're relying on a records request and a patient's checking in, wants to see their updated med list, what's the time? How long on average does it take for that to be what's reflected in the app to be consistent with documentation that actually exists in the doctor's office?
So the very first history request, so there's kind of a catch-up process in the beginning. So patients request all their information going back. That process, usually we get the records within 30 days, and then we get them into the system. So we like to tell people between 30 and 60 days, you'll have all of your history. And after that, the visit notes, we actually get very fast, because that's a lot easier for providers to share with us than going to get your whole entire history. So we've had a lot of patients actually that have had their records to us within an hour or two of the visit, and we've had it transcribed that day. If it's not that fast, it's usually within a day or two.
Because you guys put so much work in actually getting that old medication history or just like patient visits to the hospital, and you guys put it into like type format. So like for that version of the 1979 document, with the physician that sent it to you want it back, and because you actually digitally entered it, do they want it back?
So they really love the summary format that they get back, and so we have had some people that have been asked for things to be sent after that, but most patients, once they show them the visit since they've last seen them, they do say, can we get this for all of your history? Because it's usually only a few pages for your average patient when you just have brief summaries. So that is definitely a benefit to the providers as they get it back.
When you're sending it to the providers, are you sending a CDA or are you sending a PDF or it's actually going back?
It depends on how the providers can take it again. So we aren't finding a lot of providers that are taking the CDA inbound yet, but as they do, then we'll do more and more of that. Most of them are still getting things by fax for the most part. Thankfully, at least most of them have an electronic fax that it comes in and goes to their EMR electronically.
So there was that recent legislation saying that they were going to ease the laws with respect to labs coming back from lab reports coming back from labs. Have you seen or are you seeing it becoming easier to get that information from the labs, and is there an appetite for it, I assume, from the patient side?
There's definitely an appetite from the patient side. So we've had some labs that have already been responding to direct requests. Most patients really don't think about, oh, I got my labs at this place or that place. They think, oh, Dr. Smith got those labs for me. So most of the time they request it from the provider and we get it that way anyway. But we have had some now that have come, especially with some of the wellness programs for employers where they're going straight to the lab. We've had a few of those requests, and some of them have sent them directly and some have said you have to go to the doctors. I think they have 6 months to implement that new regulation.
Is there a fee for the users?
So the application itself without our service is free. So you always own your data. It's your application. So if you're somebody who doesn't have a lot of history and you want to do the do-it-yourself model, get your records and upload the information, you can do that. But our service is we sell directly to the consumer, and then we also have some enterprises that provide it to the patient. But it's a pretty good deal. It's $99 to get your records, to get all your history. So going back at least 7 years or as far back as they have it. And that's getting it all made into meaningful data and given to you to own forever. And then we have a per visit plan. So if you only go to the doctor once or twice a year, you can just buy it as you need to, that request records button. Or we have a monthly and an annual plan.
I have a question.
Yes.
Hi, do you get any pushback from providers' practices about the cost of providing the records?
So we have worked quite a bit on that process with providers. Most of the time we don't have any problem, but we have had a small percentage that have wanted to charge a lot of fees to get the records. With those, what we've really done is worked with them on explaining the benefit of what they're going to get on the back end, and that's usually resolved the issue. Thank you very much for our time. You can go to caresync.com or to the app or Android store and get that.